what she said, I work at the NC Justice Center. I've been there for 15 years, and my areas of public benefits and healthcare. The other members are Adam Searing and Adam Linker. They are our policy experts, and Adam Searing is our director. And right now they're in D.C. at the Families USA conference, where Adam Searing is getting the Health Advocate of the Year award for this year. I want to start with a quote that I'm sure you probably have all heard, particularly those who are interested in healthcare. Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. And I found this quote still troubling. This was said by Reverend Martin Luther King, Jr., the year that I was born. And now I have children where this still is timely. That means there's an issue that we still need to be working on, and we need to make sure that as things get implemented through the Affordable Care Act, that we continue as members of the community to work towards positive change in those areas. The North Carolina Justice Center's mission is to remove injustice and attack poverty at its roots. And so,
I'm sorry, but the buzz is so bad in the back of the room. Can you try without?
I can try.
Let's see if we can hear better now. That was really distracting. I'm so sorry to interrupt.
No. Just raise your hand if you can't hear me. Okay. So the North Carolina Justice Center, as I said, mission is to attack injustice and attack poverty at its root causes. The Health Access Coalition, where I work, our goal is for every single person that lives in North Carolina to have access to quality and affordable health coverage. The Affordable Care Act, or health reform, is a real step towards achieving this goal, where people will, sometimes the first time of their lives, will have health coverage. Small business owners may be able to provide it for the staff that they always have wanted to provide it for. Younger adults, those living with chronic health conditions, or pre-existing conditions, those who were over income for the state's supported health plans like Medicaid and NC Health Choice, but they didn't make enough money to pay for private insurance. Those people, for the first time, will be able to realize being able to afford premiums and have subsidies to help afford those premiums. We also want to pay attention to costs for premiums and charges for services. So there is a new website called fairhealthconsumer.org, and on that website you should be able to go in and find what the name of the procedure is you're interested in, and then what the appropriate cost and charge should be. And that's typically, I'm going to have a test in a couple of weeks. Well, I really don't know what that test costs. I know that the Justice Center has good health coverage. They subsidize me. I pay a portion for my family, and they also pay a portion for my family. But I don't know. I know my copay is $150, I think, but I don't know what the total cost would be if I had to put that out myself. As advocates, also Adam Linker and Adam Searing were on the North Carolina Institute of Medicine's implementation committees. And so in those committees, groups were deciding, and the groups were comprised of providers, advocates, consumer groups, and were to develop a set of principles to look at while health reform was being implemented. And unfortunately, though, during this process, industry giant Blue Cross and Blue Shield decided that they would go another route and get other wealthy interests like themselves file a bill where the board, which would be a voting board, which would lead the health benefits exchange portion of the implementation of healthcare reform, then there would be no consumer groups on this board. So the voting board running the health benefits exchanges, where we would go on and say, I am this years old, I want this kind of plan, and here are some of the things I can choose from. The board who would be in charge of that would be health insurers and providers. There would be no consumer groups on there. And we disagreed with that, and so since we weren't at the table anymore, we formed a group called Citizens for Responsible Healthcare, and at that time fought against this. And this was sort of unprecedented that many, from progressive to conservative to middle of the road, consumer groups thought that they should be at the table, so that bill was defeated. However, we're still not done, because before January 1st, 2014, about a year before that, we're going to have to show we're making progress to having a proper health benefits exchange, or the federal government will come in and set one up for us. And so we would like to be able to set up our own, I think, We want it state supported, but we want it done right. So an example of what we think should happen is the voting board should be comprised of people who don't benefit from the healthcare industry. Those could be consumer activists, consumers, it could be attorneys, it could be economists. And we still believe that providers and other healthcare groups could be, or insurance companies could be engaged in this, but as advisors, not as voting members controlling the board. And at that moment, we think that the voting board should also keep good actors in, good insurance companies in, bad insurance companies get kicked out. So that's something that we will be looking at, pretty soon, as probably around May. We'll be looking at that again. And then before I close on healthcare, I want to tell you a little bit more about the work that I do. I explain a little bit more about what Adam and Adam do. And my role is really connecting to older adults across the state and their caregivers and people who care about the subject. And that campaign is called the Campaign for Better Care. So I have a newsletter that I put out and send just on healthcare as it affects older adults. And I partner with AARP and the SHIP program here, the Seniors Health Insurance Program, and other folks across the state who are concerned about older adults. Ms. Rosa, she came to one of our meetings in Rocky Mount, and we had and actually attended a lobbying trip to DC with us to lobby our congressman. I think that was a great effort, and we'd like to do that again. A couple of things about the Campaign for Better Care. The two main things is we want to make sure that we all have a voice, including the older adults who are receiving services, have a voice in that in healthcare, and then whatever suggestions that you have, what works well, what doesn't, that we will take those things as a collective voice, and as we push for change at the state level and the federal level, that we have your voices, not what I think or Adam thinks or other people who are in the coalition, but what real people who are receiving real services, what you all think. And so I said a little bit before that we're not done, and that's why the national groups, the National Health Law Program, a National Partnership for Women and Families, and Community Catalyst fund the project that I work on. And I feel like that there is hope though, but in talking to people, there's some common themes. So I want to tell you a couple of the things that would kind of clue into me that I've been successful, that we've been successful, and that we're done. And I think that I won't be done until Margaret, who is in Garner, doesn't have to worry each month that the funding to the Adult Day program, where her mother is 98 years old and attends and can socialize with people like herself, allowing Margaret to look for a job as now she's unemployed, then our work isn't done. And then another woman, Geraldine from Raleigh, uses health fairs and the ER as her medical home. And she had presented with a bad headache and told them about a medication that she could not take because of her hypothyroidism, and that somehow did not get translated. And she left the hospital having had a heart attack. Now she has a chronic health condition. She's uninsured. She's over 50. So health reform will allow her to be able, with the inclusive health, because she has a pre-existing condition, allow her to be able to buy that coverage if she can afford that. So that's a story that I hope to change for Geraldine. And by the way, she was not offered the uninsured discount that the hospital should have offered her, but I told her about it, so she's supposed to get an automatic discount for being uninsured, and she was not aware of that. And the other thing is Sylvia, a lady that works in Helping Hand Ministry down in Wilmington, found out that through Medicaid, because of budget cuts, state budget cuts, that she cannot get new glasses. She cannot afford them, even though she helps people who she feels they don't have enough. But she, she has a condition where she needs to get new glasses, and right now she doesn't. So what happens if I take my glasses off? I'm not going to be able to get home because I'm supposed to wear these corrective lenses to get home. That takes my independence away from me, and that's something that we don't want for any of us to realize. So I feel like, recently we've studied about Martin Luther King Jr., some of our children, our grandchildren, our nieces and nephews. We've celebrated his birthday, in North Carolina, and I feel like if we really are believing in what he talked about, what his dream is, that we will put people in front and center of healthcare delivery, not big profits, not big business, not big egos. We work together. All of us have little control over